الله الرحمن الرحيم. النهارده ان شاء الله معاكم الدكتورة سحر زكريا Assistant Professor of Tropical Medicine. النهارده يا شباب ان شاء الله احنا هنتكلم على two topics related to two very important infectious disease, rabies and tetanus. The first we will start with rabies. Our objective today start with the case scenario, definition, epidemiology, causative agent, pathophysiology, clinical pictures, diagnosis, and lastly rabies prophylaxis and treatment. A 48-year-old female was bitten by unvaccinated dog and had a deep lacerated wound on the left leg. She didn't go to the hospital to take a suitable vaccination. A week later, the female developed fever, headache, and malaise. 3 days later, she had agitation, confusion, photophobia, and hydrophobia. On examination, neck rigidity was absent, then developed coma and died. ال WHO عملت اليوم 28 September as a World Rabies Day. to اللي هو الايه بلين اللي هو الايه for how اللي هو الايه to reach rabies free world. While rabies is a 100% preventable disease, thousands of people die from the disease around the world each day. What is the epidemiology of rabies? About 87 countries contain rabies, but more cases are reported in Asia. More than 30,000 people died of rabies every year in Asia. Every year, 10 million people require treatment and protection from rabies, which is great financial loss. On the other hand, we have some free rabies zone, for example, Australia, China, Ireland, Japan, and New Zealand. What is the rabies? Rabies is a primary zoonotic disease, يعني disease infected في mainly animal, warm blooded animal, for example, dog, wolves, and can transmitted to humans. This disease caused by a certain virus named rabies virus. This rabies virus is a neurotropic RNA virus belong to the Rabidovirida type 1. Most important in this virus the shape of the virus is pellet shaped virus. We have two types of rabies virus, straight virus and fixed virus. The straight virus, the virus recovered from a naturally occurring case rabies, but the fixed virus is the virus which has a short fixed and reducible incubation period. So the source of straight virus, it is naturally occurring virus. It is found in saliva of infected animal. On the other hand, the fixed virus prepared by repeated culture in brain of such that its incubation period is reduced. Also, straight virus pathogenic for all mammals and can't be used for preparation of vaccine because it is aggressive virus produce a disease and also produce characteristic negri bodies. On the other hand, fixed virus doesn't form negri body and can used be in preparation of antibody vaccine. What is the source of infection? الفيروس present in saliva of a raped animal. So it is the source of infection. What happen how اللي هو الايه الفيروس اللي هو الايه causing a disease او in the اللي هو الايه human. We say الترانسميشن اللي هو الايه through اللي هو الايه الانيمال اللي هو الايه bite enter الفيروس enter in saliva of raped animal. الفيروس inoculated in the muscle then اللي هو الايه الفيرال replicate and اللي هو الايه bind to nicotinic acetylcholine receptor neuromuscular junction وترانسميت to dorsal root ganglia. الفيروس travel within the axon in peripheral nerve via retrograde vast axonal transport and اللي هو الايه replicate in motor neuron of spinal cord and local dorsal root ganglia and rapid ascent to the brain اللي هو المين تارجت اللي هو الايه tissue for action of اللي هو الايه virus ان هو infection of اللي هو الايه brain neuron and lead to neuronal death اللي هو الايه function and اللي هو الايه finally centrifugal spread along the nerve to the salivary gland, the skin, the cornea and the other tissue. What is the clinical course of rabies in human? Number one اللي هو الفيرست ستيج اللي هو الستيج اوف exposure enter into incubation period اللي هي range from اللي هو الايه 20 to اللي هو الايه 60 days sometime اللي هو few days and sometime extend for اللي هو الايه years and اللي هو الايه after this ال patient develop البرودروما الستيج during this stage ال patient suffer from اللي هو الايه fever anorexia headache malaise pain and numbness at the bite site. After this the patient اللي هو الايه developed اللي هو acute neurological اللي هو الايه phase during this phase the patient suffering from anorexia CNS اللي هو sign paralysis hydrophobia photophobia delirium hallucination and later on the patient developed اللي هو الايه الكوما stage through this اللي هو الايه period the patient suffering from hypertension cardiac arrhythmia cardiac arrest and finally اللي هو patient die. This اللي هو clinical course of اللي هو rabies in human occur if the human not seek medical advice and go to the hospital and اللي هو take اللي هو anti rabies اللي هو او rabies اللي هو prophylaxis. يبقى this اللي هو clinical course اللي هو like what happened in our case scenario اللي هو if اللي هو human bitten by infected raped animal and اللي هو not take suitable اللي هو vaccination and اللي هو management. What is the clinical forms of rabies? Rabies presented in two clinical form, either encephalitic rabies or furious rabies. The second form paralytic rabies or الدم. Encephalitic rabies or furious rabies the most common represent 80% of all forms all presentation of rabies. The patient presented by paresthesia, pain, pruritus at the site of bite, with episode of generalized arousal or hyperexcitability separated by lucid period associated with autonomic dysfunction hydrophobia. The other form less common paralytic or dumb rabies وده represent about 20% also the patient present paresthesia والpain والpruritus at the site of الbite but presented with early flaccid muscle weakness from the beginning the patient presented with paralysis often begin in the bitten extremity progress to produce quadriparesis bilateral facial weakness sphincter involvement usually the patient suffer from fetal outcome. This form of rabies dumb rabies often misdiagnosed as Guillain-Barré syndrome. How to diagnose case with rabies through many اللي هو الايه steps. The most important step اللي هو الهيستوري taken from the اللي هو الايه patient, then اللي هو الايه examination to exclude other اللي هو الايه causes, and اللي هو الايه detect اللي هو الايه different اللي هو الايه manifestation of اللي هو rabies, and اللي هو الايه sometime اللي هو الايه detection of antigen by taking a skin biopsy using immunofluorescent by virus isolation from saliva and other secretion. Human rabies prevention. How to prevent affection of human by rabies. How to save human life when bitten with raped animal. Through many steps. Number one, notification local health authorities, isolation, disinfection, and immunization. We have two types of rabies human rabies prophylaxis, either post exposure prophylaxis يعني prophylaxis to the patient unvaccinated exposed للبايت by raped animal, and another pre exposure prophylaxis اللي هو protection للهاي ريسك اللي هو جروب اللي هو from الريبيز. نمبر 1 اللي هو الايه البوست اكسبوجر بروفلاكسس فور اللي هو الايه الريبيز. مين ان هاو تو مانج بيشنت اللي هو الايه كم او suffering from اللي هو الايه بايت with اللي هو الايه ريبد اور unvaccinated animal like اللي هو الايه اور اللي هو الايه كيس. some say اللي هو الايه evaluation of اللي هو الانيمال if الانيمال is still اللي هو healthy و available for 10 اللي هو الايه day يبقى الانيمال not infected يبقى not need اللي هو الايه الفاكسينيشن. what if الانيمال اللي هو الايه unknown or developed اللي هو الايه المانيفستيشن of الريبيز after اللي هو الايه human اللي هو الايه بايت يبقى ده indicate immediate اللي هو الايه treatment. what is the اللي هو الايه treatment or البوست exposure اللي هو الايه باكسز. this اللي هو الايه البوست اكسبوجر اللي هو الايه بروفلاكسس فور اللي هو الايه النوت بريفيوسلي فاكسينيتد اللي هو الايه هيومن اجينست اللي هو الايه الريبس. نمبر 1 اللي هو الوند اللي هو الايه سايت immediately اللي هو الايه cleansing اللي هو الايه الوند with السوب and اللي هو الايه water very very important step for اللي هو الايه البريفنشن اوف اللي هو الايه الريبس affection and give also tetanus اللي هو الايه prophylaxis and antibiotic. السكند ستيب اللي هو جيف اللي هو الايه الهيومن ريبيز اميونوجلوبولين. الهيومن ريبيز اميونوجلوبولين جيفن ان دوز اللي هو الايه 20 انترناشونال يونت بير كي جي بير بودي ويت. half of the dose given at the site of a bite and the remaining part given intra اللي هو الايه muscular. and next اللي هو give اللي هو الايه الريبيز فاكسين. الريبيز اللي هو الايه فاكسين اللي هو اليوزد اللي هو الايه ناو وي جيف اللي هو الايه 5 اللي هو الايه دوزز اللي هو الاتش دوز اللي هو الايه 1 مللي جيفن انتراماسكولار اندلتويد اللي هو الاريا. ال 5 اللي هو دوزز اوف اللي هو الايه الفاكسين اللي هو يوزد اللي هو الايه ناو او يوزد اللي هو الايه تو دايز اللي هو جيفن ات سيرتن اللي هو الايه تايم اللي هو ات زيرو اللي هو الايه تايم اللي هو الداي اوف اللي هو الايه البايت نيمد اللي هو 0 يبقى جيفن في الداي اللي هو 0 والثيرد وال7 وال14 اند اللي هو الايه 28 اللي هو الايه داي. اوكي. التايب اوف فاكسين وي هاف اللي هو الايه ميني تايب اللي هو نيرفس تيشو فاكسين اند الكالتشر السيل كالتشر فاكسين اللي هو الكومنلي يوزد اللي هو الايه nowadays and recommended from WHO اللي هو السيل كالتشر اللي هو الايه فاكسين because it is more potent more safe few اللي هو الايه او small في الاماونت والتايم اوف اللي هو الانجكشن اللي هو الايه less اللي هو الايه side effect. طب what we can اللي هو الايه doing for population at increased risk for exposure to rabies. for example اللي هو research laboratory worker, veterinary, animal control and wildlife worker, bat hunter, travelers to certain rabies endemic area. How can protect اللي هو this individual through what is called pre-exposure rabies اللي هو vaccine. how اللي هو الايه do this اللي هو give the high risk اللي هو الايه person اللي هو الايه 3 doses of rabies vaccine on days اللي هو 0 7 and 30 dose either on اللي هو الايه 21 or اللي هو 28 اللي هو الايه day. Also اللي هو الايه check اللي هو الانتي بودي اللي هو الايه تتر must be more than 0.5 international unit per milli. okay. طب what happen if this اللي هو vaccinated اللي هو الايه individual exposed to اللي هو الايه الريبيز then هي complete with اللي هو الايه 2 dose of rabies vaccine only on the day 0 and اللي هو 3rd and do not need اللي هو human rabies immunoglobulin. الافيكاسي اوف البروفلاكسس قلنا ان البري اكسبوجر فاكسين فولود باي بوستر اللي هو الايه اكسبوجر دوز ونو اللي هو الايه ديس ريبورتد. اوكي. we explain الريبيز ان اللي هو هيومن. what about the اللي هو الايه الكلينيكال فورم اوف ريبيز ان زي اللي هو الايه دوج. we say at the start الريبيز is a zoonotic disease يعني primary disease of اللي هو الانيمال mainly الدوج. الكلينيكال مانيفستيشن ان الدوجز اللي هو الايه more or less similar to اللي هو الايه in اللي هو الايه human also presented in two form furious rabies and dumb اللي هو الايه rabies. الفيوريوس اللي هو الايه rabies اللي هو الايه اللي بيتنيمد اللي هو typical mad dog اللي هو الايه syndrome and this characterized by a change in behavior of the اللي هو الايه animal. tendency to run away from the home, wander aimlessly, bitten anything, suffering from a change in voice due to paralysis of laryngeal muscle, also excessive salivation and foaming at the angle of the mouth of the dog, and finally paralysis of the whole body, coma and death. السكند فورم اللي هو الايه الدمب اللي هو الايه ريبيز also ان الديزيز predominantly اللي هو الايه باراليتيك. الدوج اللي هو withdraw itself from being seen or اللي هو disrupted and enter into اللي هو stage of sleepiness واللي هو الايه die within اللي هو الايه 3 days. This اللي هو slide both certain اللي هو facts about rabies you must اللي هو remember my dear student and don't forget the virus present in saliva of infected animal. main source of اللي هو الهيومن اللي هو caused by اللي هو dog bite in about 99 اللي هو %. ان rabies بيأفكت poor rural community mostly Asia and Africa result about 1 death every 15 minutes. 40% of the victim are children younger than 15 years. through washing the wound treatment through washing the wound with soap and vaccine اللي هو الايه بتافويد اللي هو الايه development of اللي هو الديزيز وبتسيف اللي هو الايه اللايف. وان انت seek immediate medical اللي هو الايه care if اللي هو الايه bitten and this don't اللي هو الايه done in our اللي هو الايه case the اللي هو الايه bitten اللي هو الايه when the female bitten with unvaccinated اللي هو الايه dog don't اللي هو الايه seek immediate medical اللي هو الايه care so اللي هو الايه developed a disease and اللي هو الايه died at the اللي هو الايه end. الريبيز اللي هو 100 اللي هو الايه او 100 اللي هو الايه preventable اللي هو disease with high mortality اللي هو الايه rate. الايم اوف اللي هو الايه اوف اللي هو الايه vaccination اللي هو الايه through الفاكسينيشن اوف اللي هو الايه الهيومن اور ايم اللي هو تو سيف اللايف. الفاكسينيشن اوف اللي هو الايه الانيمال تو اللي هو ستوب الترانسميشن اوف اللي هو الايه ديزيز. سو الريبيز 100% اللي هو فاكسين بريفنتبل اللي هو الايه ديزيز. and remember again اللي هو الايه at the start of اللي هو الايه our lecture in WHO خصصت يوم 28 سبتمبر as a world rabies اللي هو الايه day to اللي هو الايه plan for اللي هو الايه rabies free world and اللي هو rabies zero by اللي هو الايه 2030 اللي هو الايه year. Now we will discuss the second part of our topic very important infectious disease named tetanus. A definition of tetanus: non-communicable infectious disease causing sustained muscular spasm, contraction, and convulsion. Epidemiology: causative agent Clostridium tetani, which is a gram-positive spore-forming bacteria found in two forms, spore and vegetative active form. الروت اوف انتري we have many route of entry الانيمال بايت الهيومن فاكسين الاوبن فراكشر البيرنال جانجرين. الموست امبورتنت also في النيونيت via infected umbilical stump الابسس and parenteral drug abuse. الباثوجينيسيس what happen when organism enter into the human tissue. The spore of the organism when enter human through contamination with soil they transform into vegetative form. This vegetative form produce two type of toxin, tetanospasmin and tetanolysin. Tetanolysin cause hemolysis and not related to our topic. Tetanospasmin it is responsible for pathogenesis of tetanus. What happened? The mechanism of action of tetanus toxin. This tetanospasmin act on inhibitor neurotransmitter at neuromuscular junction. Do inhibition of inhibitor neurotransmitter الجابا neurotransmitter. So lead to free action of excitatory neurotransmitter producing sustained muscle contraction. We have four type of tetanus, two common type and two less common type. الcommon generalized tetanus and neonatal tetanus. less common local tetanus and cephalic tetanus. clinical manifestation in generalized tetanus. Tetanus characterized by presence of specific signs. For example, number one lock jaw or trismus. Second rhizus sardonicus or bitter smile due to facial muscle spasm. الثird what's called obsotinus. Obsotinus mean progressive and intense muscle spasm lead to characteristic arching of back and sometimes lead to fracture of the rib and elbow. second most important form of the tetanus tetanus neonatorum. neonate infected with tetanus due to cut umbilical stump with unclean contaminated instrument and female labor in unsterilized places and due to defect في immunization of pregnant female. neonatal tetanus deadly disease of newborn. الفيتاليتي بتريتش from 70 to 100%. Okay, about 4 million neonatal deaths occur per year, account for 2/3 of infant mortality. common in developing countries and poor communities. Cause are unsanitary cord care and unsterile instrument. الsymptom in tetanus neonatorum commonly appear on third day after birth وبت including difficulty in swallowing, irritability, muscle spasm, poor suckling, obsotinus, convulsions. other forms of tetanus cephalic tetanus وده rare involve seventh cranial nerve facial nerve represented by lock jaw, weakness of facial muscle. about 2/3 of اللي هو الايه كفالك اللي هو الايه تيتانوس كان اللي هو الايه progress to generalized tetanus. الاذر uncommon form اللي هو اللوكاليزد اللي هو الايه تيتانوس. وان لوكاليزد تيتانوس اللي هو الايه المسل spasm occur at or near the site of the injury and also can progress to generalized tetanus. الديagnosis, how can diagnose case with اللي هو tetanus? الديagnosis is based on clinical symptoms because the bacteria is recovered from wound in only 30% of اللي هو cases. So laboratory study, no specific laboratory test exists for determining the diagnosis of tetanus. So again, the diagnosis of tetanus is clinically based on the presence of trismus, dysphagia, generalized muscle spasm, opsotenous, sardonicus spasm, or combination thereof. Also, laboratory findings are not diagnostically valuable. But sometimes we can do some laboratory investigation, for example, lumbar puncture and CSF examination, detection of serum muscle enzyme level, for example, creatine kinase may be elevated. Sometimes do EMG, ESG, and we have what's called a spatula test. What is the meaning of a spatula test, which used in diagnosis of tetanus? A spatula test is a simple diagnostic bedside test that involves the touching the oropharynx with a spatula or tongue blade. In normal circumstances, it elicits gag reflex, and the patient try to expel the spatula. If this occurs, the test is negative. But if tetanus present, the patient develop reflex spasm of masseter and bite the spatula, and then التست is positive. How to treat case with tetanus? Also we have many lines, wound care, medication, supportive care, and vaccination. Sorry. الwound care, it is very important to wash الwound carefully with الwater and السوب or any sterilize. المedication in the form, it is a bacterial disease, so we get benefit when give antibiotic to fight tetanus bacteria. Antibiotic of choice metronidazole can give sedative to control muscle spasm. البيشنت sometimes need intravenous fluid, need ICU and ventilator. The most important point also vaccination. We have vaccination in tetanus include anti-tetanus vaccine and tetanus toxoid. Anti-tetanus vaccine, tetanus antitoxin is an immunoglobulin given to neutralize the toxin produced by Clostridium tetani. We use to provide temporarily passive immunity. It does from 1,500 to 6,000 units. التيتانوس توكسويد best tool to prevent tetanus. We recommended for people of all ages. However, الانتي-توكسين level decrease within time. So we need routine booster dose of tetanus recommended every 10 years. After 3 doses, almost everyone immune. A pregnant woman should be immunized against tetanus, and this can prevent neonatal tetanus. How are this vaccine given? The DTaP and DT preparation are all given as an injection in the anterolateral thigh muscle for the infant and the young toddler, or in the deltoid muscle for the older children and the adult. But the TDAP and TD are given in the deltoid muscle for children and adult age 7 years and older. How many doses of tetanus toxoid vaccine are needed? The usual schedule for infant is a series of 4 doses of DTaP vaccine given at second والfourth وال6 months and اللي هو الايه from 15 to 18 اللي هو الايه months of age. ال fifth shot oral booster is recommended between age of 4 and اللي هو 6 اللي هو الايه year. For people who were never vaccinated or who may have started but not completed series of shot a 3 dose series of TD should be given within 1 to 2 months. Between dose 1 to 2 months. ال WHO tetanus toxoid immunization اللي هو الايه schedule قالوا ان اللي هو الايه الفيرست اللي هو الايه دوز اللي هو not give protection or اللي هو الايه not give protection. السكند دوز give اللي هو الايه protection up to 80 اللي هو الايه percent for 3 year. اللي هو الايه الفورث اللي هو الايه دوز give protection اللي هو الايه 99% اللي هو الايه protection for اللي هو الايه 10 year. How to prevent tetanus? Tetanus can be prevented through immunization. Neonatal tetanus can be prevented by immunizing women of a childbearing age with a tetanus toxoid either during pregnancy or outside of pregnancy. This protect the mother and through a transfer of a tetanus antibody to the fetus also her baby protected. البروجنوزس about اللي هو 25% to اللي هو 50% of people with generalized tetanus will die. Very young and old tend to have more severe disease. Death is usually due to respiratory or cardiac failure. Intensive medical care improve the prognosis. Maternal neonatal tetanus strengthening routine immunization of pregnant women with tetanus toxoid vaccine. All pregnant women who have not previously received a TDAP should be vaccinated in the 3rd or late 2nd trimester. Finally, we need certain factors on tetanus disease. Remember, tetanus is acquired when the spore of bacterium Clostridium tetani infect a wound or a newborn umbilical stump. The spore are universally present in the soil. Spore germinate to produce an exotoxin named tetanospasmin that cause rigidity and spasm of voluntary skeletal muscle. People of all age can get tetanus, but the disease is common and serious in newborn babies. Neonatal tetanus is a significant problem in developing countries due to poor umbilical stump hygiene and lack of maternal immunization. Neonatal tetanus requires treatment in the medical facility, often in a referral hospital. Acute condition required intensive care. Prevention is by immunization. Thank you, my dear student.